This is Robert Boisneau. He was my best friend when we were growing up. Rusty and I were pals. I never had a brother, and he became the brother I never had. When he went off to college at Florida State, I went off to Emory University, which is where I met my lovely wife. And I followed Rusty very closely during those years, and it was during those years at college that Rusty was diagnosed with a cancer called Hodgkin's disease. When Margaret and I were in Pensacola and I was going through flight training, we took a week off and went back to Orlando, and I talked with Rusty. That was the last time I saw Rusty. And he said, let's go out for a walk. So we walked for about 100 yards until Rusty became so very short of breath, I had to carry him home. And he said, isn't it bad that I've got to lean on my best friend to even make it a few feet? And then he talked about quality of care, and he said, you know, Norm, he said, I'm getting really good treatment, but he said, somehow I feel like a number, not a name. And I feel like I'm a part, not a person. And I told Margaret that if I ever became a physician, none of my patients would ever be treated like numbers or would ever be treated like a part. They would be treated like people. This young lady I treated over 10 years ago for the same disease, Hodgkin's disease, very advanced. She is alive and well over 10 years later, no evidence of disease, and she will be the first one to tell you that she received not only excellent treatment, but she also received excellent care. This young lady I met 3 months before she was born. Her mother was diagnosed with Hodgkin's disease, and she received full course chemotherapy, which was the right course of treatment for her to receive. Within a few months after she completed the full course of chemotherapy, it was found that she had recurrence, and they recommended that she undergo salvage chemotherapy. But it was during that interval that she had become pregnant, and she refused to abort, and she wanted to carry the pregnancy to term. Her mother, this little girl's grandmother, was a nurse that I had worked with for years, and she called me up on an early Friday evening and said, Norm, you gotta help my daughter. She's dying. She's lost 28 pounds during this pregnancy. She's as white as a ghost. She can't breathe. So I made a house call that Friday night. Yes, I do make house calls. And she was dying. And I told her that both she and the unborn child would be dead by the end of the weekend if we didn't do something. So I put her on oxygen. We started her treatment that night. And the reason I had to treat her was because when she sat there on the couch talking to me, her arm was elevated to 90 degrees because the mass under her right arm was so huge, she couldn't lower it down. She couldn't sleep lying down because the mass in the middle of her chest was so huge, it literally pressed her airway closed when she lay down. And so I told her that I would shield the fetus, we would treat up away from the fetus in an attempt to shrink the mass. And God knows, and it was He that made the difference, that mass went down like I stuck a needle in a balloon. The mass under her arm completely disappeared, as did the one in her chest, and it allowed her to complete the pregnancy and deliver a very healthy young girl. After the delivery, I had to complete the rest of the radiation because the mother had it on the top, below the diaphragm, down into the pelvis. We had a lot of work to do. And that's about 15 years ago. This young lady is approaching high school as a straight-A student. The mother is alive and well without any evidence of disease, and they have adopted a second child. We are not asking you for a check, but rather we are asking you to believe in the person that this picture typifies. For it is not a place, it is a purpose, a plan, a person and people we call physicians that make the difference. It is not the echo of a large building, an overhead intercom system, or the sound made by a treatment machine that makes the difference. The physician makes the difference. Thank you.